Welcome to Everyday Nursing Knowledge Lectures, and today we will learn how to identify ST segment elevation, or what is significant ST segment elevation. ST segment begins from the end of S wave. This is S wave. So from the end of S wave, which is called J point, and it ends at the beginning of the T wave. So ST segment, it connects QRS complex and T wave. So ST segment is a flat line. It's a flat isoelectric line. Isoelectric line means there is no electrical activity in the myocardium. It's the resting phase of myocardium. That's the reason it's a flat isoelectric line. Now QRS complex represent ventricular depolarization. When the cells depolarize, ventricles contract. And T wave represent ventricular repolarization. When the ventricles repolarize, ventricles relax. So QRS represents ventricular contraction and T wave represents ventricular relaxation. So ST segment is a time interval between the ventricular contraction and ventricular relaxation, and it should be flat isoelectric line. So changes in the ST segment, either elevation or depression, may represent myocardial ischemia or myocardial infarction. Now, what is significant ST elevation? You call it as ST elevation if the elevation is greater than 1 mm at the J point, and you compare J point to PR interval, which is the baseline, in at least 2 or more contiguous lead. What is greater than 1 mm elevation? So in an EKG paper, time is measured horizontally and voltage is measured vertically. It has multiple large box, and in a large box, it has multiple small box. In a one small box, the width is 1 mm and the time is 0.04 seconds. So if the elevation is greater than one small box, you call it as a significant ST elevation. Now look at this picture. This is ST segment, and it's a flat isoelectric line, and when you compare with the PR interval, it's at the same level. Now look at this picture. This is the ST segment, whereas the PR interval, which should be the baseline. You look at the J point, which is here, the end of the S wave. The J point is elevated by one small box. That means it's greater than 1 mm. So it's a significant ST elevation. Again, it should be significant if it is present in at least 2 or more contiguous leads. What is contiguous or consecutive leads? Contiguous lead means leads that shows the same area of the heart. Example, when you do end-to-end lead EKG, lead 2, 3 AVF, it shows the inferior portion of the heart. Whereas V5, V6, 1 AVL and AVR, this shows the lateral portion of the heart. V1 and V2, this shows the anterior septal portion of the heart. V3 and V4 shows the anterior apical portion of the heart. So these leads are contiguous leads. 2, 3 AVF are contiguous, 1 AVL, AVR, V5, V6 are contiguous, V3, V4 contiguous, and V1, V2 are contiguous or consecutive lead. Sometimes V1 to V4 are called consecutive leads because it shows the anterior portion of the heart. But remember, V2 and V4 are not, because V3 comes in between. So if the ST is elevated in 2 contiguous or consecutive leads, it is called as a significant ST elevation. So ST elevation, which you will measure at the J point, that means at the end of the S wave, it should be greater than 1 mm. 1 mm means one small box in at least 2 or more contiguous lead. You call it as a significant ST elevation. Now, along with ST elevation, you look at the shape of ST elevation too. The shape of ST elevation can be convex, which you will see like this, or ST segment can be straight, which is elevated but straight up sloping, straight horizontal, or straight down sloping. This all may suggest ischemic changes. Whereas in this picture, the concave shape, this is QR S wave, and this is the ST. So concave shape are less likely caused by ischemia, because there are other causes of ST elevation, which are pericarditis, left ventricular hypertrophy, and early repolarization. But always correlate clinically and inform the physician. Now let's see what is reciprocal changes. Reciprocal changes means you are looking ECG from the opposite side of the injury. So if there is an ST elevation in 2, 3 AVF, remember 2, 3 AVF is inferior. the opposite to the inferior should be superior, but heart is irregularly shaped, so there is no superior, instead it's anterior. If there is an elevation in 2-3 AVF, in 12 lead EKG, you will see a ST depression in the anterior lead, which may be from V1 to V4. That also indicates an ST elevation MR. In this 12 lead EKG, you will see an ST elevation in 2, 3 and AVF. So there is inferior MR. But you are looking EKG from the opposite side, that is the anterior view, you will see an ST depression in V2, V3, V4, etc. Same, if there is an ST elevation in the anterior lead, you may see an ST depression in inferior leads. So that is reciprocal changes in EKG. So today we learned about ST segment elevation, or what is significant ST elevation, and thanks for watching my video.